When you were born, your shoulder got stuck as you had to pass through a small space. This caused damage to the nerves passing from your neck to your arm, leaving your arm completely weak. The group of nerves in this area are called the brachial plexus, and this injury is therefore known as plexus injury. Nerves are like tiny wires that send electrical signals to your muscles. If these wires are damaged, the signals can weaken or even disappear. If the nerve is pinched or stretched, it might only be slightly damaged, causing the signals to become weaker, a bit like dimming a light. In more severe cases, where the nerve is cut or pulled out entirely, no signals can get through at all. Your body works hard to repair the damage as quickly as possible, and often it does a great job. From having a very weak arm at birth, you might be able to move it after just a few months. Sometimes the body is unable to repair the damage well enough on its own and needs some extra help. Doctors might perform surgery to reconnect the damaged nerves using small nerve segments taken from nerves in your legs. And sometimes if the nerve is totally unplugged from the top, then surgery might involve sharing one of the other nerves that is stronger. And this is usually done when you're about 6 months old. But even after the repair, the nerves might not work as well as those on the other side. This can affect the whole arm, but is most common for the shoulder and elbow to be more difficult to move. For example, it might be hard to lift your hands above your head. In the shoulder, some muscle pull your arm outward, while others pull it inwards. It's almost like two teams in a tug-of-war. Usually, these muscles are equally strong, but when you have a plexus injury, the inward pulling muscles become much stronger because they receive more signals from the nerves, and we need to help the weaker outward pulling muscles to become stronger. There are several ways to help them. Stretching your shoulder daily helps the weaker muscles move the shoulder more easily and prevent stiffness. At first, your parents will assist you, but later you will be old enough to do it yourself. You can also train the muscles to make the weaker ones stronger. You can do this by climbing, going swimming, doing exercises in water, doing wheelbarrow races with a friend, or doing exercises with a rubber band. However, sometimes even with stretching and exercising, the shoulder may still rotate inwards. In such cases, the doctors might perform surgery to lengthen a muscle on the stronger side, like this. If that isn't enough, they can also move a muscle from the stronger side to the weaker side to make the two teams more equal. In this video, we have only shown how to address one type of movement in the shoulder, but these principles also apply to other movements in the arm. Due to the plexus injury, your arm will never be quite like the other. It might look a bit different and often be thinner or shorter, but don't let that stop you. Use your arm as much as you can in daily life and in activities that you enjoy. So on days when stretching, training and all the checkups feel tiresome, remember that with the help and support of those around you and the hospital staff, you are helping your arm be as good as possible.